Exercise Medicine Canada presents Dr. Sunita Mathur, professor and physiotherapist from the University of Toronto. Moving more and moving right, the basics of exercise prescription for healthy living.
Great, thanks Winta, and thanks for the invitation to come and talk to you guys. I'm going to talk today a little bit about exercise prescription and how to go about counseling someone on getting more physically active using the exercise prescription pad that's provided by the EIMC and how you'd go about doing that. So I had 5 objectives that we'd like to cover today. So one is just to differentiate between physical activity and exercise, because we sort of use those terms interchangeably, but they have a little bit of different meaning. So just talking about one over the other. And then talking about exercise as a behavior. So what are some barriers to people not being physically active, and what are some facilitators? And the importance of health behavior change in trying to get people to exercise more. Then we'll go over the EIMC prescription pad and how to use it in the apparently healthy individuals, and then learn about when to use the referral section of the pad. So when someone has a chronic disease or maybe something that you're not sure about, when would you refer on, and who could you refer to? How would you actually go about doing that? And I will show you a couple of resources and programs that are out there for chronic disease groups, because a lot of people that you're going to see are not going to be perfectly healthy, and their exercise programs have to be tailored a little bit more specifically, but there's lots of resources out there to help those individuals and get them going and get them active in a safe and effective way. So since you guys are already here in this group, I know that you already believe in exercise, you know it's important, and you know that it has a really big role in prevention of disease and also management of a lot of conditions. And as you've probably heard many times, it's the one kind of magic pill that everyone's looking for that can affect multiple conditions, and the side effects are also really positive. So you might be exercising to improve heart disease, and at the same time you're actually helping to reduce your risk of falls or helping to prevent osteoporosis. So exercise, when it's done in proper dosage, a proper intensity, and a proper frequency, has really big benefits, and it affects a lot of different conditions. So what do we mean when we actually say exercise? So as physiotherapists, we sort of think about a gradation from basic movements all the way to exercise. So when we talk about movement, that's sort of the core. Exercise is a movement. When we talk about any kind of movement, it's just changing your body position. So it could be moving a limb or moving from a bed to a chair. So just your basic, just moving your body from one place to another. So that's what we consider movement. So of course, in exercise, you are doing movement, but movement's sort of your broad topic. Our next term that we use is physical activity. So physical activity is used quite a lot, and we hear this term every day. People should be more physically active. You need to have a physically active lifestyle. But how is that different than exercise? So physical activity is actually a bodily movement, so it's a subcategory of movement that results in energy expenditure. But it's pretty broad. It could be household activities, so vacuuming the floor is a physical activity. It could be a leisure activity like gardening, but it could also be a fitness activity or a sporting activity. So physical activity is very broad. It captures everything from work-related activities, leisure activities, household activities, as well as sports and fitness. So there's a little bit less structure to physical activity. You could count the minutes per day that you're physically active, but being physically active could mean instead of taking the bus, you walk. Instead of taking the elevator, you take the stairs. Or it could mean that you play sports on a certain night of the week. So again, it's a pretty broad term, and it has kind of a varied application. Then when we talk about exercise, we're being very specific. So exercise is a term that we use for very specific planned, structured movement that's repetitive, so you do it at a certain dose and frequency and intensity, and it's really aimed to improve or maintain your fitness or your health. So it has a really specific prescription, what we call an exercise prescription to it, or it has a goal aligned with it. So if you're going to the gym and you really want to improve, say, your leg strength, then you're doing specific exercises to do that, and you're doing them at a specific intensity and dosage. Whereas if you're being physically active, you might just be, moving around more, walking more. It can incorporate some of your exercise, but it's more of a broad term. So we want people to incorporate both physical activity in their daily lives as well as a structured exercise program. That structured program could look very different for different people depending on their goals. So another really important thing about both exercise and physical activity is that they're behaviors. And even though we talk about a prescription for exercise, it's not that straightforward that we just give the person the prescription and they follow it and everything is fine. Just like a medication, not everyone follows the prescription, not everyone takes it when they're supposed to. With exercise, even more so, because you need to make time for it. You know, it's an activity, you've got to carve out some time in your schedule, you need to go maybe to a specific location, or you might need to have specific skills in order to be able to actually do it. So it is a health behavior, and so we need to think about it as a behavior change when we want someone to become physically active when they've previously been sedentary. So when we use the term prescription, it sort of gives us the idea that we prescribe them something and then people just follow it. But of course we know that's not the case. Even with our own selves, we all know exercise is beneficial, but there's times of the year that you're busy and you don't really do the program that you expected to do. There's always things that are competing interests in the way. So it's really a behavior. So it requires behavior change for a lot of people because most Canadians are not physically active or not doing exercise. And it also requires something called self-efficacy, which is your own confidence in your ability to make a change or your own ability for motivation to do something. So that's a really key concept for exercise and physical activity or for any behaviors. So what we want health professionals to do is really have consistent messages to encourage healthy habits. So that can be physical activity and exercise, healthy eating, reducing substance use. So as a group, if we give people consistent messages about exercise and physical activity, just like we do about their diet and smoking and alcohol use, then that really helps and encourages that individual. It really helps with the self-efficacy, it helps with the behavior change, because they're hearing it from multiple targets. So as I talk later about, exercise and chronic disease, where you may not have all the skills to do that, if you still encourage that individual, you tell them about the benefits of exercise, that's really going to help them make those changes. So we really need a team approach when we implement exercise and physical activity. And as you know, it's really needed because most Canadians are sedentary. About 1/3 are engaged in physical activity of the recommended amounts, but 2/3 of people are really not. And a lot of people aren't actually sure what to do or how to do it. So there's a big gap here, and so the more we can get health professionals on board, I think it'll make a big change for our society. So commonly cited barriers. There's always a reason why not to exercise. So I just wanted to get your thoughts on what you think would be some common barriers that people would have to either starting an exercise program or trying to continue it. So you just need to press the button that's in front of you, and anyone, any ideas of why? All right, so Swapna, if you want to go ahead. I think that's you.
Yeah, lack of time.
Sorry, could you repeat that?
Lack of time.
Yeah, so lack of time definitely is one. Anything else you could think of? Why not? Why would people not want to exercise other than time? Anything else you could think of? Yeah? Yep, lack of knowledge, for sure. That's another really commonly cited barrier. It's like, what are the benefits? If you don't see things right away, a lot of people don't think that it's going to be a benefit to them. So these are some that are in the literature. Competing priorities, so that's kind of the lack of time. Everyone has work priorities, home, family, things that they need to take care of. So also, all those competing interests play into the amount of time you can spend doing exercise. Physical limitations is another major barrier. So having pain, is exercise going to make it worse? A lot of people have concerns that if they have a condition, say like high blood pressure or something, is exercise actually going to be dangerous for them? Access is another major barrier that people cite. So if you join a gym or something, obviously there's a cost associated with that. Transportation, trying to get to a fitness facility can be a barrier. The weather in Canada, definitely. Some people, well, many people will say they're more active in the summer than they are in the winter. Building access is another thing, and just getting in and out of fitness centers, just navigating around different centers. So a lot of older adults don't like the traditional fitness gyms because there's a lot of tripping hazards, there's mats everywhere, the machines are not really accessible. So we need to think about those access issues. Motivation and beliefs. So although we know exercise is good, not everyone really thinks that it's going to change their health. So if you don't really believe that exercise and physical activity are health-changing behaviors, you're less likely to do it. And lack of understanding about the amount and lack of knowledge. So what are the potential benefits versus the risks? So people really cite these as major barriers to exercise, and this is where we can really help people in terms of beliefs about exercise, improving their understanding, finding accessible locations, addressing physical limitations. So a lot of things that we can actually work on. So in terms of facilitators, things that could actually assist people in doing exercise. Sorry. Does anyone have any thoughts on facilitators for exercise? Why people would exercise? Yeah, go ahead.
Friends.
Yep, so having a social circle or doing something with friends. Yeah.
Sense of empowerment.
Yeah, sense of empowerment. So actually physically doing something can make you feel good and give you some self-confidence. Anything else you can think of? Yeah. Yeah, so inclusion in some kind of program, whether it's in your student fees, workplaces have health and wellness programs where the fitness center is right at the workplace, and they even have incentives. So lots of external incentives can really help. So again, personal beliefs about exercise, whether you think it's important. Perceived health benefits, if you think it's going to improve your health, you're more likely to do it. Enjoyment. Professional promotion is actually a really important one. So if a health professional tells you that it's good for you, that does help people. And that's where we need, physician recommendation and all healthcare professionals to really push it. We've done a study on barriers and facilitators of people who had an organ transplant. And one of the facilitators they said was if their transplant physician told them that exercise was important, they were definitely more likely to do it. And it's sort of surprising that not all transplant physicians would do that, but there's so many things along with the condition that you might be thinking of that you may not mention exercise. But even just mentioning it is a really important motivator for people. Professional instruction is another one, so having someone show you how to do the exercises safely and appropriately. Social interaction, as someone mentioned, friends, and positive self-efficacy. As I mentioned before, the confidence to perform a certain health behavior. So this is being studied quite a bit in relation to physical activity. So if people feel confident that they can change a behavior or maintain a behavior, they're more likely to be able to do their exercise program. So assessing self-efficacy is a really important part of exercise behavior change as well. So in terms of behavior change, there's lots of different models that people use in terms of behavior change. The trans-theoretical model is one that we use quite a bit in exercise, but you'll see others as well. A lot of people you're going to see are going to be in these early stages. So pre-contemplation, meaning they're not really thinking about it yet. Contemplation, they're sort of thinking that they want to do something to become more physically active, but haven't really made any distinct plans about it. So when people are in these early stages, and you can find out pretty easily just by asking them about, are you active already? What do you think about exercise? If they're in the early stages, handing them an exercise prescription is not really going to work for them because they're not really ready to take on an exercise program. Really what they need is a little bit more of a discussion about what is exercise, what is physical activity, what are the benefits, what are potential risks, and what are their current health behaviors. Have they tried an exercise program before and they dropped it for a certain reason? What were some of those previous attempts like and what were some of the barriers? So when people are at these early stages, you really want to focus more on a discussion and getting them engaged in a bit of a talk and a conversation about exercise. When people are at the later stages, they're more preparation to action. They're ready to start the program or they've already started it or looking to get engaged with exercise. That's when we can give them more of a prescription and direction of what to do. So these are the people where we can provide resources and materials like an exercise prescription. We can give them guidelines that I'll talk about in a minute. Still important to discuss barriers and facilitators because you need to know what's going to facilitate them to be part of the program. And provide a referral if needed. So if you notice one of the barriers is they have chronic condition or pain or something, then referring to the appropriate professional will help. So how do we know where people are with exercise or physical activity? There's lots of different ways to do this. There's many, many questionnaires out there. There's of course, accelerometers and different things, pedometers, you can count steps. This is a really simple physical activity screening tool called the RAPA, which means Rapid Assessment of Physical Activity. It's freely downloadable, and someone can fill this out within a couple of minutes. And it just asks them how often they do different levels of physical activity. So I rarely or never do physical activity, and then they ask about light, moderate, vigorous, and there's even a question about strength training and flexibility training. So if someone does this questionnaire very quickly, you get a very good overview of what is their current physical activity. It's not going to give you, their minutes per day or anything like that, but it does give you a starting point. If they rarely or never do any physical activity, that's a different conversation than someone who's already doing moderate or vigorous. This person may just need encouragement to maintain it. The person rarely doing activities needs a bit more of a conversation of their perceptions of exercise. So this is a really nice quick screening tool, and as I mentioned, it's freely available, so you can just go to University of Washington website and download it, and very easy to use. So once you have an idea of where that person's exercise is, then we want to address different components of the exercise program. So when we think about a comprehensive exercise program, it generally has 4 components. The endurance or aerobic activities, that's the one we tend to focus on the most because it's linked to cardiovascular health, which has been linked to mortality or early mortality. So aerobic activities are things that are going to get your heart rate up and improve your cardiovascular fitness. So things like walking, running, and cycling. Strengthening activities is another second major component of an exercise program. So these are the ones that target muscles and bones. And we know that muscle weakness as we get older is one of the major factors that prevents people from living independently. So if you lose your muscle strength, then you're not going to be able to get up out of a chair, you're not going to be able to do your toileting and your independent activities. And that's a major limitation as we get older. It can also help improve your bone health, so reduce risk for fractures and risk for falls. So most programs focus on both of these, aerobic and resistance training. We can also add in balance activities, particularly in older adults, and flexibility activities. Those are good for improving your range of motion, potentially reducing your risk for injury if you have good range of motion. So every exercise program should have all of these components, at least the aerobic and the strengthening component. So the Canadian Physical Activity Guidelines, have you guys seen these before, the CSEP guidelines? Some of you have. So you'll know that if you go on the CSEP website, that's Canadian Society for Exercise Physiology, they have physical activity guidelines for every single age group, all the way from newborn, infant, toddler age groups to older adults. And they have very specific guidelines on how many minutes of physical activity you should be doing and what should be the combination of aerobic strength and balance. So you can see the guidelines. These are evidence-based guidelines based on 13 or more systematic reviews of the best evidence for exercise, and they're being used around the world. They were developed here, but they're kind of taken up worldwide because they were really well done. So when you look a little bit more specifically at the guidelines, you'll see that for aerobic exercise, it recommends moderate to vigorous intensity activity for 150 minutes per week. So for a typical exercise program, that might be 30 minutes, 5 days a week. We don't encourage people to do the entire 150 minutes on one day. Like some people do this weekend warrior sort of thing, that they exercise for 3 hours on Saturday and nothing for the rest of the week. That's not the best way to do it, especially as you get older and you may have some signs of heart disease and things. That high intensity on one day a week is not the best way to approach the program. It's better to break it up during the week. So you could do a couple of sessions 3 times a week, or you could do a little bit shorter sessions 5 days a week. The other component of that is that you don't have to do the 30 minutes all together at one shot. You can actually break it up into 10-minute bouts. There's not a lot of evidence to say whether it should be 5 minutes or 10 minutes, but generally the expert recommendation is that it should be at least 10-minute bouts. So if you broke it up in the morning, at lunchtime, and after work type of thing, you could do 10-minute bouts of activity to get your 30 minutes of day. So that works as well, and that works well for a lot of people. It recommends muscle and bone strengthening 2 days a week. So in addition to your aerobic training, you should be doing some strengthening exercises at least 2 days a week. And flexibility and range of motion, they haven't really specifically talked about it in the current guidelines, but in the previous guidelines, it was recommended to do those sorts of exercises daily. it doesn't have to be an extensive range of motion program, but even first thing in the morning, just doing, range of motion for your joints really makes a big difference to prevent injury and when you're going to do your exercise. Or it can be combined as part of the cool down after you do your aerobic training, when your muscles are nice and warm. Now, in terms of some more specifics, when it gets to the older adult population, it also recommends balance exercises. Again, usually about 2 to 3 times per week, and specifically for people that have poor mobility. So if they have any balance issues or they have slow walking speed, those people really need to do balance exercises because it's going to reduce their risk for falls, which can lead to fractures. And in children and youth, it's actually more physical activity. So 60 minutes a day of the moderate to vigorous physical activity. On at least 3 days, children and youth should be doing vigorous physical activity. A lot of kids don't meet these guidelines. You might have seen the physical activity report that Canada got a D grade rating for children's engagement in physical activity. So we haven't been doing a really good job at getting kids engaged with physical activity. But now with these guidelines, it should help because at least now we know what the target is. The other thing that it mentions for children and youth and not for adults is to reduce sedentary and screen time for less than 2 hours per day. So in the guidelines, it's really nicely laid out. It kind of gives you a structure of the day, walking to school or walking to work to be active with your transportation, throwing in some physical activity during the day, doing some very specific exercise, maybe in the first thing in the morning or in the evening. Just ways to really incorporate physical activity and exercise throughout your day and reducing screen time. Do you have a question?
Yeah. So for the section about older adults and balance exercises,
Yes.
what if it was an older adult with peripheral neuropathy? Would you also recommend balance exercises?
Sure. So the question is, if you have an older adult where balance exercises are recommended, if they had a peripheral neuropathy, something that's actually going to affect their balance directly, would you still recommend it? So in that case, if they have a condition that's really affecting their balance, then yes, because it's going to be trainable through balance exercises, but they would need a referral to someone who can really assess the extent of their balance deficit and do a program that would be really specific to really target that. So peripheral neuropathy is definitely amenable to exercise training, and you can work on the other parts of balance to help kind of overcome the fact that they have the neuropathy. But you wouldn't want to send them home just with any balance exercises because of the risk of falling. So it would be better for them to be referred on to a falls and balance clinic or to a physiotherapist in the community to get a full out assessment and then a specifically targeted program. So this is the exercise prescription pad from Exercises Medicine. And you'll see on it that it does talk about reducing sedentary behavior. It has aerobic or cardiovascular activity and strength and resistance training. So those are the main components of the program that we want you to encourage people to do. And then there is a section here for referral for additional expertise or to an exercise professional. So I'm just going to go through the different parts of this pad and how would you actually go about filling it out. So we'll start with the aerobic activity because this is the one that most people are going to focus on, and it's sort of the easiest way to get started because aerobic activity, as simple as walking, doesn't really require any specialized equipment or gear or skills training. Really, most people are able to engage in some kind of aerobic activity. So we use what's called the FITT principle, and that's outlined specifically on the prescription pad as well. And when we talk about the FITT, we talk about frequency, intensity, type, and time of exercise. So as I mentioned before, we're aiming for people to be active at least 3 to 5 days per week. If they're going for fewer days per week, they're going to have to do longer bouts of exercise. If they do more days per week, they can do shorter bouts. The intensity, what we're aiming for is moderate to vigorous. For healthy people, they should be able to engage in moderate and then progress to vigorous activities. In terms of monitoring intensity, ideally they should monitor their heart rate. That gets a little bit tricky to teach people to do that. So I'm going to show you something called the RPE scale that is a little bit easier way to teach people about monitoring their intensity. The type of exercise is any kind of dynamic, large muscle group type of exercise. And the time we've already talked about, 150 minutes per week. The one thing that's not really included in that prescription pad is it talks about how many minutes you should be doing your exercise, But you should also encourage people to do a warm-up and cool-down. If the bout of exercise is more than 10 minutes long, they actually need a warm-up and a cool-down before and after. So if they're going to do 30 minutes of moderate intensity exercise, they actually need to warm up for 5 minutes before that and cool down for 5 minutes after. So it ends up being 40 minutes total, with the warm-up being a lighter intensity of activity. So if they're going to walk briskly, they can start off with a little bit of lighter walking or on a level surface. And then they do their 30 minutes at a brisker pace, incorporating some hills, for example. And then for the last 5 minutes after the 30, they need to slow down gradually. Most of problems that happen with exercise happen in the cool down. While we're exercising, the sympathetic nervous system is sort of running everything very efficiently, so you don't really notice any palpitations or abnormalities. You're kind of going along and you're fine. If you stopped abruptly, that's when people can feel lightheaded. They can develop arrhythmias if they're at risk for that. So that's where we want to have this cool down phase. It's really important to help prevent any of those adverse effects of aerobic exercise. So the training period is the 30 minutes or the 40 minutes, and then you want to warm up and cool down on top of that. So in terms of intensity, this is sort of the trickiest part of the exercise program, is how hard should people be working? It's hard for people to know what is moderate, what is vigorous, should they be doing moderate exercise, how do they judge that? So the best way for people to know their intensity is to actually have a target heart rate. Now, if you go to the gym, you'll see target heart rate charts on the walls of the gym or right on the machine itself. It'll get you to enter your age, and it'll tell you what should be your target heart rate. So we can often use age-predicted target heart rate. A very simple equation is 220 minus your age. That works pretty well in healthy people. And then you exercise at a certain percentage of that age-predicted max. Now, in the clinic, you may not have time to go through all of this, exercise prescription based on heart rate, teaching someone how to take their pulse, or finding out if they have a heart rate monitor. So a simpler way to kind of get around the intensity calculations is to use something called rate of perceived exertion, or the Borg scale. And this is a scale from 0 to 10, where people judge how hard they feel they're working. From nothing at all, which is like resting, lying in bed, sitting around, to very, very heavy or your maximal exertion. And we want people to be working in that moderate range, which is 3 to 5. That's the range that we're targeting when they're actually doing the intense part of their aerobic training. So this is a subjective scale. It's going to be individual for people to judge how hard they feel they're working. But people are generally pretty good at judging, how hard they'll feel their heart rate and their shortness of breath go up. They start to feel a little bit sweaty. That's getting them into the moderate range. So most people are able to judge this quite well. If there's problems with literacy or numbers, then people are going to have trouble with this type of scale. Or some people are just not very good judges of intensity. So they may not be very good at using the scale. In that case, another really simple way that you can teach people to exercise at the proper intensity is the talk, sing, gasp test. So what we want people to do is when they're exercising, if they're able to sing out a song loudly and to their exercise partner, that means the exercise is too easy. It means that they're able to get in a lot of breath in and a lot of breath out, so much that they can sing. So singing puts you in the low intensity range. If you're gasping for air, that you can't even speak while you're exercising, then you're working too hard. You're more in this very heavy to maximal range. So if you're gasping for air, that's too intense of an exercise. What we want people to be able to do is talk while they're exercising in short sentences. So carrying on a big, long conversation, again, it's probably too low intensity. But if you ask them a question and they can respond in a short sentence, then you're working at a pace where you're a little bit out of breath, but not completely gasping for air. So you can always give people the talk, sing, gasp test and tell them they should be able to talk while they're exercising. That'll probably put them in the moderate range. So those are a little bit simpler ways to get around the issue of intensity. That's where people have the most questions of how hard should the exercise be. If they're going to see an exercise professional or go to the gym and get a trainer, then they would get more information on monitoring heart rate. Or if they ask you questions about monitoring heart rate, because there's lots of apps where you can monitor your heart rate, you can use the easy age-predicted heart rate max, 220 minus age. And most people should be exercising anywhere between 40 to 80% of their age predicted max. So again, with the heart rate apps for fitness, a lot of that information is included there, but just reinforcing that can be very helpful. Did you guys have any questions about the intensity? Let's go. Good. Okay, so just going back to the FITT principle, if we have kind of a very straightforward sort of example, so we have a 53-year-old that walks about 15 minutes per day, so she walks to the bus stop and back. She has a sedentary job, so she's sitting most of the day, but she wants to improve her fitness. And she doesn't have any known cardiovascular disease, lung disease, metabolic conditions. If you're going to fill out this card here for her, what sort of numbers might you circle on the first time that she comes in? What might seem reasonable? So any thoughts on frequency for days per week that you might start with? Yeah, sure.
Maybe 2 or 3.
Yeah, to start 2 or 3 days per week. So starting on the lower end, she's pretty much sedentary, not doing anything. So starting on the lower end is a good place to start. It's feasible for the person to do, and it's probably not going to make them overly exhausted. How about intensity? What would you encourage? Light, moderate, vigorous? Any thoughts on where you might want to start? Yep.
Light.
Yeah, you could start with light. She doesn't have any known disease, so you might even be able to encourage her pretty quickly to moderate, because our goal is to get them to moderate, but definitely wouldn't want to start at vigorous, because that's just going to be way too hard. It could be putting for the person as well, if they've never really done much activity before. So light or moderate would be where you'd want to go. And in terms of time, where might you start in terms of time? Yeah.
30 minutes.
Yeah, 30 minutes. So our guideline always, it says if she can do it on a couple of days per week, then we can get her to do 30 minutes. And she could also accumulate it with shorter bouts during the day. In terms of the type of exercises, when we say aerobic training, what kind of things might you encourage for this type of individual for aerobic training? What might be a very simple thing that she could do?
Walking.
Yeah, walking, definitely. As I mentioned before, it doesn't require any special equipment. It doesn't require you to go to the gym. You can do it outside. You can do it at home. So walking is a really great way for people to get started with an exercise program. And once you put some structure around it, it does become an exercise program. It's not just her walk to and from the bus anymore. Now there's some structure behind it. She's got an intensity to work at. She's got minutes per day. She's got days per week. So even something as simple as walking can be a very effective exercise. So just thinking of some options here. So if you want to meet kind of your general guidelines for physical activity to get started, 3 days a week, moderate for 30 minutes. She can start with walking. Maybe if she's interested in running in the future, she could do a walk-jog program. Lots of those are available online. Or another activity of interest. So finding out, is there a particular type of physical activity that she likes, or an exercise that she likes to do? For women especially, group classes are really popular because women tend to really like the social interaction. So we've seen that in the literature a lot, that the women love kind of aggregate towards group classes, and you'll see that in, at the gym as well, or with running groups. It seems to be really female dominated. So that might be another way for her to get started. The other thing you want to do is when you set up this prescription is discuss any barriers that she might be facing. What are some of the facilitators? What could help her? Does she have a partner that she could exercise with? That really helps people. Providing a copy of those CSEP guidelines for her age group, because they actually come with log sheets and everything as well, so that can be really helpful for people to track their exercise. And following up. So the next time you see this person, asking about that exercise program, how's it going? Were there any challenges with it? Did you maintain it, or did you kind of fall off the path and need some motivation to get back on it? So really important to ask about exercise the next time you see the client. Another way to get people walking is the steps per day. I'm sure everyone's really familiar with steps per day because now people have, their own accelerometers and pedometers that they're wearing. There's apps on your phone that you can count how many steps or kilometers that you walked in a day. The 10,000 steps per day is really popular because it's a great internal motivator. People like to see numbers. They want to be able to meet their goals. They can compete against friends. You can go online and have challenges. So this is a really effective way for a lot of people to get their activity in. It doesn't have to be a particular type of physical activity. The steps per day will pick up a lot of different activities that you do. Not as well with upper extremity, but definitely with lower extremity. Your routine background activity will not get you the 10,000 steps. So that's why this works, because it actually encourages you to do something more than just what your daily activities are. So daily activities are only going to get you about half of your steps, so you have to do some targeted exercise to get yourself to the 10,000 steps. In Canada right now, there was a very large community health survey done, and they actually got a large number of people to count their steps per day over a period of a week. And the numbers were not too bad, actually. People weren't really meeting the 10,000, but the men were pretty close. In women, we do know physical activity is a little bit lower. Only about 1/3 met the 10,000 steps per day. So again, a lot of room for people to improve. When you look at people with chronic disease, you'll see that their steps per day are more around the 4,000 range, because the amount of background activity that people do when they have a chronic condition tends to be really low. So they're not even doing as much activity as we would, just sort of walking back and forth at work or at home. It's very low. So their total steps per day only gets to around 4,000. So the next part of that prescription pad is the resistance training. So strength or resistance activities. So when we say resistance activities, what do we actually mean by resistance training? Do you guys know any examples of what you would think of when you think of resistance training? Yeah.
Like body weight or weighted stuff?
Yep, so weight exercises or body weight exercises. So anything that you're kind of lifting a weight or using your body weight to create a force around your muscles or bones. So they can be machine weights at the gym, dumbbells, ankle weights that you wrap around. There's even resistance bands that you can use, gravity resistance exercises. There's also Pilates uses a lot of core strengthening. Certain yoga postures are strengthening exercises, as well as Tai Chi is really good for lower extremity strengthening. The thing with resistance training, unlike aerobic training where everyone can usually do something like walk or run or ride a bike, resistance training does require a little bit more specific instruction, because you need to know what weights to lift, how to do the movements, what's the proper posture to do it, and that kind of thing. So there are some more specific instructions required here to help reduce the risk of injury. So on the prescription pad, it's just giving you days per week and what kind of activities somebody could do. So if you had your same woman, in terms of days per week, how often are we recommending that people do resistance training? Yeah, sorry, go ahead. Yeah, 2 days per week for resistance training. And what might be some examples that somebody could do in terms of resistance training if they're just getting started out with resistance training? What might be something they could try? Yeah.
Like body weight squats?
Yes, squats would be a great exercise. Doesn't require a lot of additional, instruction, something you can do at home. It just uses your body weight. You can do squats with your back against the wall. You can do it carrying a bag with books in it to make it a little bit harder. So that's a great type of exercise. It doesn't require any additional equipment. So, 2 days per week. I like the idea of doing some kind of body resistance exercise because you don't require any additional equipment. You'll be surprised, a lot of people do own dumbbells. They just have them sort of sitting around in their closet or whatever, so you could always get them to dust them off and give it a try, doing some light dumbbells at home. Community exercise classes is another great way to learn resistance training, or going to the gym and getting, a session with a personal trainer to learn how to use the machines. So if we make this case just a little bit more complicated, same person, but now she has type 2 diabetes and hypertension. Both are controlled by medications. So how might that change your approach in terms of giving that exercise prescription? What might you do differently? What might you consider that you didn't really have to consider before? Yeah.
Maybe take down the intensity a little bit, because they might be low in blood sugar or stuff like that.
Right, so you might not be able to start them right away at a moderate intensity because, you know, they already have diabetes. That's going to be an indication that they need more careful monitoring. So that prescription pad, you know, you can tailor it a little bit more. You're going to have to go on the lighter side of the exercise prescription. And you're going to want to use this section for referral for additional exercise assessment and counseling. So someone with type 2 diabetes is already putting them at a higher risk to have an adverse event during exercise. You already mentioned low blood sugar. That can happen with exercise. So this person is going to have to learn a little bit more about how to exercise safely. There's a really nice set of Canadian Diabetes Association guidelines for exercise for type 2 diabetes. So you want someone who's familiar with those guidelines to be undertaking this kind of exercise program with this client. So you can still counsel them on the importance of exercise. Actually, both of these conditions can be affected by exercise training. So it's a great benefit for them to incorporate exercise. But in terms of giving them the program, you're going to have to give them a lighter program to start that they can go home with, but referral on to a specialist. If it's an older adult, it's the same sort of thing. So some additional considerations for someone that's older. So now the only thing that we've changed is that she's 20 years older. She's not going to work anymore. She's retired. And she's feeling tired and worn out. So this is a really common complaint for people as they get older. They're losing their strength. They're losing their endurance capacity. So there's some additional things that you need to consider once people get over the age of 60 or 65, because the number of chronic conditions that people have as they get older really increases. So in the younger age group, even if we're looking at people between 40 and 65, a lot of those individuals are going to already have risk factors like hypertension or high cholesterol, their general aches and pains as well. But once people get over the age of around 65, you'll start to see more incidents of heart disease, diabetes, arthritis, osteoporosis. So now they're more likely to have risk factors and actually have chronic conditions. Safety becomes an issue with risk of falling, risk of exercising by themselves in case, say, they do have low blood sugar or something like this. Access to exercise programs is lower in older adults. They don't feel as comfortable going out to a lot of the community fitness sort of programs, but there are tailored programs specifically for seniors that really overcome some of these access issues. The other thing with, as you get older, it takes you longer to recover from exercise training. So what you'll notice is that people will have sore muscles for a longer period of time. They might feel tired on the same day that they do the training. So the intensity has to be really appropriately given so that they don't get any overuse injuries, that it allows adequate time for recovery, and it progresses at a proper rate, that they get adaptations. So when we look at recommendations for an older adult, then we might want to change around some of the ideas on the prescription. So you may still want to try and encourage 3 days a week, but you're going to go for a lighter intensity, maybe a shorter period of time. And strength exercises, again, in older adults, it's still recommended 2 days a week. But now you'd want them to probably learn how to do the exercises properly because the risk of injury is going to be higher and it's going to take them longer to recover if they did injure themselves. So going to a community class, meeting up with a personal trainer or a physical therapist to learn how to do exercises appropriately will be more beneficial for this, for an older age group or someone with chronic disease. As well, the referral section becomes really important. You want to get them off to somebody who can give them a really targeted exercise program. So in terms of chronic disease, as I mentioned, it does go up as people get older. And these are sort of the really common chronic diseases in Canada. And every single one of them is amenable to exercise. Exercise can either help the symptoms of the condition, it can help prevent progression of the condition, or in some cases it can actually prevent the condition from occurring altogether. And there's very specific programs for all of these different types of conditions that are available in the community. So I'm just going to show you a little bit about the resources that are available out there. Because the exercise prescription for chronic disease does require referral to an exercise professional. You can definitely encourage people that have chronic conditions to exercise, tell them about the benefits, really get them motivated to do it, but what they're going to do has to be really guided quite appropriately. And the reason why is the exercise assessment becomes really important. We can't just sort of guess what the intensity is. The intensity has to be titrated very specifically based on exercise test results so that we know what is that person's max capacity and what can we train them at. The program needs to be really individualized. So a 10,000 steps per day program may not be feasible for someone who's only walking 2,000 to 3,000 steps per day already. Monitoring becomes really important. So what is a safe target heart rate? And progression. So with every exercise program, it needs to be progressed, and we need to know how much progression, how often should the exercise program be progressed, when has that person plateaued. So we want to allow for proper adaptations and overload. So because of all of these additional factors that need to be considered, that's why we really need a referral to an exercise professional. So this is just an example of a chronic lung disease. So this is something that I do some research on. And when you see the history of this particular person, they've got a long history of smoking. They get short of breath with walking uphill and climbing stairs, limited participation in just their general activities, and they also have a fear of breathlessness. So when they get short of breath, they really want to avoid it because it's kind of scary to them. So this person is going to kind of start declining and doing less and less activities, which is going to make the shortness of breath even worse. So in this case, that exercise prescription pad is going to only give you a little bit of an ability to give them a program. You're going to probably say light activity, but for this person, light activity is potentially going to be really, really light. It's going to be very different than an apparently healthy individual. And it's because their exercise limitation is really multifactorial. They're getting shortness of breath with exercise. People with COPD have a lot of muscle disease as well. And they might even have cardiovascular conditions. So you're going to have to consider so many different factors in their program. Their exercise capacity could be really limited. So even 10 minutes of continuous walking could be too much. They may not be able to do 10 minutes of exercise. So the program might have to be more like an interval training program. And they could have additional comorbidities. So someone who has a long history of smoking, they might have hypertension, they might have heart disease already. And in COPD especially, they might even need oxygen, supplemental oxygen, while they're exercising. Because if they start exercising and their oxygen goes down, that can put them at risk for arrhythmias and hypoxemia. So in this particular case, you really need a referral to a group of people who understand the physiology behind the lung disease and how to prescribe exercise for that. So there are pulmonary rehabilitation programs specifically for COPD. So I just put an example of this just to get an idea of what would happen in some specialized program. Pulmonary, cardiac rehab, they all look really similar. Diabetes, cancer, you'll see similar layouts. There's going to be an exercise evaluation, some kind of exercise test. In COPD, they'd also look at oxygen requirements, come up with an individualized program. Same idea in terms of the FITT principle. They're going to have aerobic and strength training. They're going to closely monitor the progression of the training because the progression is going to be really slow and it's going to require a lot of very specific titration. They can use specific adjuncts to training. So upper extremity training is something really specific to COPD, inspiratory muscle training as well. In addition to the exercise, people who go to these specialized programs are also going to get education about their condition. In COPD, we teach about energy conservation or breathing techniques to help relieve shortness of breath. And you'll see similar education programs for cardiac disease or diabetes. So going to a very specialized program that's condition-specific can really help people learn how to exercise safely. They're going to get lots of improvements, and then they can be referred on to a maintenance program in the community. So we want to refer to an exercise professional. These are two ways you can do it. So there's Find a Physiotherapist on the Ontario College of Physio website. There's also Find a Kinesiologist for registered kinesiologists on the College of Kinesiologists website. So you can find people that specialize in particular areas. There's also a lot of supervised exercise programs out there in the community. So cardiac rehab and prevention. Here in Toronto, there's multiple places you can go for that. The Toronto Rehab Rumsey Centre is really well known for cardiac rehab. Women's College has cardiac rehab. There's multiple places. There's multiple pulmonary rehab programs. There's places you can go for cancer rehab. There's bone fit instructors have been specifically trained about osteoporosis, fall prevention programs, and there's community programs for seniors. So just finding the right program can be really helpful. There's also guidelines for special populations. There's only 3 right now by CSEP, and they're mostly in neurological diseases, but there are specific evidence-based guidelines for those specific populations as well that you can find on the CSEP website. So just to summarize, encouraging physical activity and exercise to your clients is really important. Just to get the conversation started, see where they are in terms of their readiness for change, their self-efficacy, and their barriers and facilitators. So knowing where they are, following up with them, and then providing that exercise prescription to get them started. So using the exercise prescription pad, it doesn't work for everyone, but in apparently healthy individuals, you can get them with that pad to get them active right away. With older adults, you can get them started with some light activity, but they might need further evaluation depending on what conditions they may or may not have. And in chronic disease, you want to use that section that's referral to an exercise professional, because then they can get some really specific guidelines on their training program. So I just wanted to end with that. Thank you. Thanks, guys, for the invitation. Thank you.
So when you're prescribing exercise prescription, so I've kind of worked with people before, and they seem to lack motivation when you're not around. So
Yes.
what would you recommend to kind of like give them more motivation? Because what ends up happening is, if I'm with them, they have the motivation.
Yes.
But then on their own, they don't want to do it, and then it's just, you know, it's a constant struggle like that.
Yeah, it's very true. So people exercising completely by yourself or without a trainer or somebody who's kind of giving you that guidance constantly is very difficult for people. So finding an exercise partner, even if they're not a healthcare professional, is very helpful for a lot of people, because people are very good at being accountable to somebody else. So if you were just going to go for a run after work by yourself, you're more likely to be able to put it off because you're only accountable to you. But if you said you were going to meet somebody, you're more likely to do it because you know someone's waiting there. So having an exercise buddy, using the apps and the software that's out there really helps people as well, because it's like an external tracking, keeping a log of their exercise and trying to set goals to maintain it. That seems to motivate people as well. And also setting up their own rewards. So having a reward or an incentive system. And what we try and encourage is that the reward is not like unhealthy food, so that if they exercise for the week, they get a piece of chocolate cake. We try and avoid those sorts of rewards, but something that's another healthy kind of activity, or something, you know, a day of relaxation, or go out for a movie or something like that, that they can reward themselves with something else if they maintain their exercise program. So really tracking things, people really engage in the program more. And there are online communities as well, like with a lot of the apps, you can track against other people, which can help. It's good? Yep.
Just trying to make it quick. So I think like we have a lot of healthcare professionals who know about exercise, they're educated about exercise, and some advocate for it, some don't. And even those that advocate for it maybe can't do it to the extent that they want to. And so kind of the shift that we've seen in obesity for the past decade, 2 decades, what do you think is going to be the thing that may exponentially increase the physical activity from like now until the end of, say, our generation? So seeing the same kind of shift that we've seen obesity rise, seeing that same kind of fall, where do you think we need to implement things? I mean, I know there's a variety of initiatives, whether it's like parks in like city areas or like school programs, but based on your expertise and your experience, where do you think is the biggest like bang for our buck in terms of advocating and really like putting resources towards?
Yeah, so I think in terms of like our obesity epidemic, obviously it's multifactorial, as you mentioned. Like there's a lot of things that go into it, and we do put a lot of pressure on individuals that it's, you know, it's your behavior that's going to change things, and that is important. Individual behavior does change things for sure, but I think what can really make a shift are some of those external factors in our community. So if we're making communities more walkable, for example, if we're having incentives at workplaces or time at workplaces for people to exercise, incorporating it in their everyday lives, it's going to make it a lot easier for individuals to do it, because time and competing interests is a big barrier to people, and finding a place to exercise is another barrier. But workplace incentives work really well. Having things in the community that allow people to engage in physical activity. So I know on Family Day, for example, a lot of the community centers opened up for free so people could try a lot of different activities. So they had free access, they could try something, they might find something that they really like, and then they'd be able to engage in it. But I think we can't only focus on the individual making that behavior change by themselves in isolation. We really need to set up a network and a community for people to be active and really value that. Because right now, our values are very much on how busy you are, you know, the more work you do is better, the less you sleep is better. But we know health-wise that's not the case, and that's really not where we should be shifting. And you know, that's why people are picking up fast food, and that's why people aren't making room for exercise, because they're so consumed with, you know, sort of more of those material outcomes. And making health an outcome would be where I think we could really push, make it better for people. Other questions or comments? Yeah.
Actually, just to kind of build on that, is there anything that we can do to kind of advocate for a systemic change there? Like, how do we direct this?
Yeah, in terms of how we could change like more public health policies and public, like it's more in that public health arena, which isn't really my expertise area in terms of public health, but you know, organizations like CSEP do have public health campaigns. There's participation, you know, lobbying governments to help make physical activity more accessible to people. Like they did implement the tax credit for physical activity to get your kids involved. So things like that do help. But if we can lobby for more of that, getting more physical education into schools, that can make a big difference for people, because if the whole family is active, it really encourages everyone in the family to be part of it. So there's a lot of public health campaigns that I think we could be involved with. So I think looking out for those is a good thing to do, but I'm not super aware of all of the things that are going on right now. But it's definitely a good way for your group to move and get involved with some of the public health campaigns. Even on campus, like the things that you guys are doing on campus really does help. I know the movement breaks in our class were really nice because we bring people into the physiotherapy program, which is all about movement and activity, and we actually have them sit for 6 to 7 hours a day, Winta will know. We talk all day about how we need to move and do exercise, but what do we do with our students? We have them sitting all day, so it's a bit of a contradiction. So we've been trying to get more movement breaks and things into that. And I think, you know, the more we're trying to do it at the physiotherapy conference as well, getting people to move around, because it's the same thing. We're talking about exercise and then we're not leaving any time for people to do it. So those sorts of things make a big difference. Other questions? Good? All right.